Deputy Commissioner East Khasi Hills District Kong Aisawanda Lalu Mata Janmit Lakhot ya ka Iathir Jingmut lang bat ki doctor ki bapau khmat ka jylla hapok office trikam ka jong I hagani ki Iathir Jingmut bat ka tai sani bha ka long Halor ka jinglong juman jong ka Koit ka Khiah jong ka jylla lai donlang Dr. M Basayomoit pada DMHO Dr. A Lingdo pada ADMHO Dr. S Khongla pada District Immunization pada Dr. R Marak pada District Surveillance Officer layo ya ka jingkren ki babun kimat hagati ki jinglang bat kimat ki bakongsan ki blai kren kalong halo ki jingai injektika kabade kalat ka banyada nakjing yo yaw covid kabala ad Dr. M Basayomoit ka jing pancha halo ka jingbun ki case hagini ki sngi ka jing priang ki khubor lamler hagi social media pat kwi de kiman nakanyang deputy commissioner kal aru yak jing pancha halo ka jingdon jong ki dawai covid nalor pala depon order shusho na sabar namar kalasdang bandon ki jingduna ha ka jingdon jong kane ka dawai.
So we have with us our DMHO, Dr. Manoj Basayomoit, our additional DMHO, Dr. Adrina Lingdo. We also have our District Immunization Officer, Dr. Khongla, and Dr. Robert Marak, who is our District Surveillance Officer. So I wanted to call this briefing in order to give a snapshot of the present status of cases, of deaths, and of contact tracing in East Khasi Hills district. We wanted you to get a glimpse of what is the present position. We are the district with the highest number of cases in the state, the highest number of hospitalizations, and the highest number of deaths. And also to share some ideas about what the present strategy is, which the government has announced from time to time, on how we can further contain the spread of the virus, how we can equip ourselves with knowledge and with appropriate information in order to tackle this pandemic, and also to encourage all the members of the public to come forward for vaccination, which is the only assured and most effective way of protecting our population.
So total cases yesterday we had was 12,129 and active cases till date is 1,801, of whom 41% were fully vaccinated out of these total cases. So if we see the positivity rate till yesterday, it was about 13%. Returnees, we have 12% out of these new cases, and active cases till today are 1,907. The deaths today we have is 7 deaths, and the total deaths till today are 170. So as if we see, East Khasi Hills constitutes more than 60% of the total cases of Meghalaya, and average cases, as I said, is 180 per day, and last year it took us about 90 days to get this number of 180 cases, which we are getting in one day. So we can know the severity of the disease and how fast this disease is transmitting now from person to person. Average symptomatic cases we get every day is about 54 cases. That is about 30% of the total cases. And average serious cases per day is about 5 cases. The total deaths which we have is 654, of which, this I'm talking about yesterday's numbers, of which 366 were occupied and 298 are still available as of yesterday evening. I would just like to say, on the public health point of view, that we are at war right now. We should think that we are at war, and we are at war with an unseen enemy whom we can't see, and the enemy which transmits to us through our friends and spreads to others also through us. So when we are at war, only thing we can do is either fight or flight, right? But we can't flight, we have to fight. And we also need to know what are the strengths and the weaknesses of the enemy. We know what are the strengths of the enemy, transmits from person to person through respiratory route, and we also know what are the weaknesses.
As we have heard, what has been shared by our district surveillance officer, when it comes to the deaths, out of the total deaths happening in Meghalaya, we have around 170 deaths happening who are residents of our district. So this scenario is very grim, very sad. And then when we talk about the deaths, we have also seen the trend that is, the deaths usually occur among the elderly, the comorbid, those who already have these diseases, which makes them very vulnerable and thus ends up in losing them. But we have also seen, especially this year, that the trend is, of the deaths happening has also affected the age groups, which are not considered to be elderly, has affected even the age group which has no comorbid condition. 7 deaths. There was no history of anyone getting vaccinated except for the one I said who died in Long Jingshai. He had received his first dose only on the 23rd of April.
Bagaimana yang kata ya sngi kita ki COVID appropriate behavior kita ki laitali ki W by madam ila ong and when you don't rose away but there kaba ya apa la shisnam bakapa ka ya ka vaccination ngaku aban ong handi baka don ka target ka ban ila shu shin kelum ba ni kemilanti bala kumno Riu hajar rice pa prak armut kibriu kiba hadan hapo asal Shillong ni ka Shillong agglomeration kidai kiba asal pusan senam kerta bat kiba day benyo ya ke injection habai kaya ka ni pat hadu menden kasgi kidon lai kupra hajar niau spa niau mut kiba la kenjo asal pusan senam shenai bila yo ya the first dose but yidang don shisha ka jingduna Namar bang dan kamban yo 6%. Himla ban ong ni kwa tang 0% lagi 0%. But having ken lang pa there but ki frontline workers but ki healthcare workers ki bala pinjo ya ka safusan snem sheneng ya ka Shillong agglomeration ni like got kumba 100% ki bala shim ya ka ni ka injection. Hoy kepala ongi madam let's say kamling 100% protection hari hukum ka dia kapor nyemla apan kuat kata 100% lada 70% protection ru nyin yo apa protection banam point ICU hari ni menden ka smi Dr. Mevan jong Robert Hospital ong ke ka goal ke jomi hari ai ka vaccination the goal is whether if it is reaching the ICU the goal is 100% but if it is for milder disease then 70%. The goal jadi kalau 100% habagi 6 point ICU la dani yo ya ka jingpang COVID.
A large number of persons who do contract COVID-19 do not need hospitalization. Bon ki bayo kem ya uni uknyang jingpak kim long ki ber serious hadu kata-kata let's say ki don ki dak kishin lan ki symptoms ki balong mild ki ba kendiat kensot ka jing shitmet kendiat kensot ka jing jerho kendiat ti kumno ban monitor ila de kumno ban pethu ila de ban tip lara kini kita kishin kilong ki badon kamno ban report sa hospital ki ki dawai ki badai bandi ki ki bapila ban le khanang ban te ya ka immunity bat ya ka met ka phat ka jongpi bat ki lat kilenti ki bapidon hapo snong jongpi ban yo ya ka jingyarap lingba ki healthcare workers ti kata ka ni khot ya ka home management minta ka health department kadang yakhi menta kadang persang ban set up yakini ki home based management teams kabana ka NHM menta ngidang khot ya ki nurses ya ki khna ki balapas ya ka BDS ani ka nursing ban wan shakmat ban long kum kita ki community volunteers ki community nurses for home based isolation and home care. Yakni ngidang le namar kalong ka bakong san bat ka badon kam hadu kata-kata ban pethu ban bot din ya ka jinglong jingman jong kitu ki ba shop hop hayeng bat ki bam da don ya ki symptoms ki ba hadu kata-kata baleng ong ya kani kalong nakada bangiyo i ba ki hospital kuma pilayo smu mentan bun ki ladap te om barok ki kesru ki badon kam bandai hospital namar ki hospital ki dei ban keta lani ban ai shwai ka jing sumar ki tu ki ba la khamjur la kham serious tila dei ba piyo ya corona pidei ibrio ibakot ibakya don ki symptoms pikwa ban tip nle kumno la hi ban sumar hayeng la hi ban aya ka jing yarap hayeng tika ni ka konsep ka bangin sa aya ka training ya kini ki community based volunteers but ya ki shnong ki thau ling ba ki link dop ling ba ki kot ling ba ki training ki bangin sa ay
Untuk perkat muntaban kidang kuan pendunai kita berkhoi because ni have up nesi kandon ka wave ka bakhamjur banwan te har to por kumba ngi madam nada idap ki Jaintia hospital dan ni quarantine isolation jakat tingin bu hai kini tingin pa ban slur ki paiba bai ki case ki balong mild kumba ngi madam Shillong mild fever mild cough kira ban sumahi la de hai tamak hapsa ka isolation te kadang kaniga pamphlet balik. If I tested positive, what should I do? So first thing is don't panic. Don't panic. Isolate yourself at home. Reach out to your local health authorities. Monitor your symptoms. When they call you, let them know what symptoms you are having. And then always use the mask, hand washing and your distancing. If possible, isolation will be best in a room which is separate with a separate toilet so that your mixing up with other members of the family is very much reduced. Okay. Most cases can be easily be managed at home, mild cases. So reach out to your local doctor or to your local COVID management unit and determine the severity of the symptoms. They will through the questions and answers, they will be able to determine the severity of your symptoms. So individuals with no symptoms or very mild symptoms like low-grade fever, SpO2, oxygen concentration in the body, which is more than 95%, and no breathing difficulty can isolate safely at home. So look for a well-ventilated space to quarantine, and to ensure maximum distance between you and other members of the household, choose a separate room with an unattached toilet, which you can use for yourself. Then you can call the 14410 helpline, which is a dedicated line to call up the health workers to tell about your symptoms, or any time that you feel like talking to anyone for any help, any doubt, please call this number.
The contact tracing. See, what we do is that whenever we get a positive case, okay, we have a team in the respective localities or the respective area from where the positive case comes, who would be calling up on these positive cases and find out in the past 10 days whom all we have met. So we do the risk profiling and find out whether the contact was a high risk contact or a low risk contact. If the person had not followed any of the precautions and the person was in close contact, that means the person was within 2 meters, right, of the positive case, then we take that person as high risk. Or if they have been together in the same room with no proper ventilation for more than 15 minutes, even then we consider those people who would have been in the same room to be high risk contact. So what we do is we arrange for their testing, and then we have the transport cell which brings all these contacts to either Polo or Civil to get them tested.
And as you've seen from the data that we've collected, the number of cases tested positive, or even the number of deaths happening, it has clearly shown that there is a community spread. Okay, if there's a community spread, containment measure is to just further contain the spread. Okay, enable maybe the contact tracing, the testing, okay, and also to be able to identify the positive cases early, so that again we get to prevent the deaths happening. So that is the main thing, about containment. And regarding the rising cases in spite of the containment, and you showed the numbers also are increasing, is because it is already there. So the containment just helps to contain or to prevent further spread of the disease. The messages, I think, which are being spread in the media, especially through WhatsApp, through Instagram, they've been more effective than the positive messages that we're trying to, also give from our department, from the district administration. And maybe the reason is that they lack the clarity of how this, the vaccination will protect them. So that is why we are working hard on creating awareness at every level, at every platform that we get the opportunity to. Because even among our healthcare workers, we have to work hard to make them understand how the vaccine works. That is one. Number two is that maybe the fear of adverse events, which is always happening with immunization, that also is being taken care of through these awareness programs. And like I said, we try even to share the data, like we have just shared with you all about, I think I just shared 100 regarding the adverse events which are happening following immunization. Do we have vaccinated, as Dr. Khongla had shared earlier? The data till yesterday was 104,692 people who had been vaccinated, but the number of AEFIs, or adverse events happening, are only almost 90, till yesterday, and out of which most of them, around 98%, are very minor events, meaning it's only fever, mild fever, which is taken care of with paracetamol, body ache, weakness, giddiness, and these subsides in a day or two. And then we also give them the contact number to call us in case it persists. But so far, during the follow-up, we found out that they subside in a day or two. So this is what we're trying to share always at every platform in order to remove or allay that fear of adverse events. But I feel that the media really plays an important role in order to address also the vaccine hesitancy. So I think I will take this opportunity through you that please kindly spread the positive messages or the importance or the benefits of vaccination.
You have gotten a glimpse of the situation in East Khasi Hills, in which the numbers are on the rise and the spread is everywhere. We have a locality-wise breakup, a zone-wise breakup. As you know, in the Shillong urban agglomeration area, we have divided it into 7 zones, and we have our CNRD blocks, and we have seen that there is almost no locality or no area which has been spared. In Dr. Robert's presentation, he has shown that now, if we look at a single day data, yesterday's, returnees constitute only 11% of the cases which are positive. 48% are contacts, 24% are people who suffer from ILI, SARI, other types of symptoms and come to the hospital, and 6% are those who have no travel or contact history whatsoever. So 78% of our cases are not returnees. Our focus all this time, our focus during the first wave was returnees, track them, isolate them. Now there is already significant community spread. Just to give you a snapshot, these are yesterday's figures in Lagankra, which falls under zone 1. Localities under Lagankra area, 157 cases. Localities under Laban area, 152. Under Sadar PS station, the localities there, 158. Under Lomdingri PS, 106. Under Maupat and surrounding areas, 190. Madanluting, 134. Maulai, 146. When we go to the CNRD blocks, Mauringkaneng, 28 cases. Kharashnong Lakro, 16. Mauphalang, 28. Shella, 22. Mausanram, 9. Pin Ursula 17. And when we look at the number of cases in the rural areas as well, we see that there is an increase as the days go by. even with these containment measures, the question which was raised earlier, why have cases increased even if you have contained, even if you have put down these restrictions? Please remember, the cases which are detected today are those which were possibly spread 5 days, 6 days, 7 days ago. A death which occurred today is the consequence of someone not wearing a mask 10 days ago, right? The steps we take today will only bear fruit, or we will only see results a week later, 10 days later. So this is the nature of the disease which we are grappling with, which we are battling with right now. You have heard that in rural areas as well, there are significant numbers of cases. I'll just read out some figures for you. Sora 16, Maudiang 14, Smith 13, Mauplang 10, Shakitai Nyong Kendong Ru, Kaladon Kajing Sapriang, Jong New Khnyang Jingpang, Haki CNRD Block Jongi, Kibakeleng Sawdong, Ilayo I, Babaro, Kiladon Case, Bad Ladon Ru, Ki Containment Zone, Habon, Kijaka, Kum Hajongsha, Hapo Ishamati, Bad Hasoyong, Bad Shaway. Tang mentara sngi hai artho sal kentang yo artli ki kes ki bayap na soyong tekane ka pen I yangi bakila don bun ki kes shakithan nong kendong kabala bandei nakadaw jong ka jingrung ka jingmi ka jingwan jong ki bliu shasor ka jing letra jong ki udi uknyang jikpang shakithan nong kendong tingi don kam ban sungthu ba ka jingmut jong kane ka jing perking ka lockdown ka dei ban pinduna ban pin sange shi sindon shwa bakan poi kata ka situation ka bangi ong ka bang ngidum la ban control shu ti hakabya dai bat kani ki points kumbiat na kaliang tonga kilong ba sungha ban kenmau ba ni baro gi dai ban don ka chingkit kli halade bat na ka benta ki bahayeng ba sem jongi benta iway I positive case ipin sapriang sha artho samngut lada don kano ka case hakaway ka long yeng ni yo I ba kumno ru shispa na ka shispa ki kelalong positive. Kidon ki yeng ki bagi la hapan contain baro siyeng namar baro kila kela positive. Kito ki jingyap ki ba I doktor ila pule ki pen I bakini ki brio ki bernio postnem prato sausnem ki bam jumi shano haton nangno ki yo e ka jingpang. Kamut bala don ki bahayeng ba sem jo ki khon ki kseu ki parlok parajor ki ba tre ba yakta ba yat shani shatai bat ki ba le se kim da deng mas kim da bot pikir ye kini kindon ki wan ra yu khnyang jingpang ki shitom ki brio ki bala tlop lupa ka bormet te ka jingkerpat na kaliang jonga ka dei ba nila ong ba containment ka ba mut ban pinsuki ban pinsange shisendon ya ka jing sapriang jong ni ujingpang ka jing tlop jong ni ujingpang kalong bala dang nga deng mas pi deng mas pi yang ndu put piang shimitan na jonga unum yo lat ban kinti unum yo lat ban infect ya pi ladangi la ban bot tek ya kini kendon hapo khat sau sngi in one incubation period ngin la ban te la kam shi sendon ka point ka baar ka bagila yakren sapang u vaccine ngatrai ngamdon kam shu ban bun ketin halor kata henrengi kentu ya kibreu ban wan shakmat kenmau batang hadin kendai 4% jong population jong ini yo ya utika nginum la ban long protected 70 to 90% of us need to be vaccinated so that we can achieve herd immunity. The other option is that every one of us gets infected, but if that is the case, then many of us may also lose our lives. So please let us take that sense of responsibility to fight the virus. Kabang ako aban ongru ngin yale ye uni uknyang jingpang daka jing start daka jing tip. We will fight this virus with knowledge and with science, not with hearsay, not with rumors, not with false beliefs, and not with sentiments. Ni don kam ban snap iki doktor langi kthakli gilet saki doktor langi bayong khli ngilet saki doktor langi pang ni uni sitom ngilet saki doktor ni snap ni bot tek kum babatay maki menta ki ong wan shakmat ban shim ya kanika jingyada balay ni randin tingi kentu ngi kerpat gilayo ya ka jingkersan ka bahadu kata-kata na kaliang jong kisnong kinong yalam niam henry dangdon hi ki section ki bampat wan shakmat ka health department ka district administration ka covid task force on the district task force on covid-19 ka ploy ban wan shakmat ban pinsha ya kinu kijing atatin ban ay ya kijing hikai halor kani so ba ban deng ya laki mas nila ay ko order ba kajing deng mas hatemo kajing deng mas klem datap ya khmut kajing deng mas khli kanum don jingmen toy iru em wear your mask and wear it properly. Ngimla bantip kan long kumnu la shai la shisni henre la dangi bot thik bat ni sumar sukhe de kini kendon ngatharai ngin la ban yada ki pi ki pathon ki jongi. The last point I want to address is regarding the containment, because there has been a question on it. We are trying our best, and in the past 5 days since the containment measures have been put in place, we have seen that there is public support. People have respected the lockdown. People have understood what is the purpose of the lockdown. Let me tell you that the lockdown is not to, like I've said before, inconvenience anyone, but crisis times calls for critical and urgent measures. We have to act now whilst we still have time. The state government and the health department is doing everything in its capacity now to augment our health resources. By tomorrow, the Corona Care Center at IIM Khmih will be set up, will be functional. We have placed orders for more oxygen, for concentrators, and we believe that we can do this. We will not be able to go for lockdown forever. We will not be able to shut down our economy forever. Kanum la long. Nginum la banle satya ya kata bangin khangdam shisendon hinre kum bakalong minta kadang peloy than ban aya kanukunukurai. Ngidang hap ban bot pikir ya kini ki baro, but hadien ba le se ngin hap ple suki ngin hap aila di breu ban kamai im jakpo ngiru ngidon kam ban let chaki kam ki jam ki jongi ngim dei ban shim sting shu ngadang yo ban let rung sakat tu kat ne ki government office ki private office ki bank sak ba ki breu ki dang yo bun ktien klem da ding mas kin mau ba phin yo kem ni khniang jing pang na ki breu ki ba phi itho hi iba Robert ila ong Dr. Robert ila ong ba our positivity rate was 16%. Iway na prangut 1 out of 8 persons tested is positive. In this room, we are 20 of us. So 3.5, 2.5, at least 3 people here, if we test, we are very likely to be positive. So it means what we have stressed on during the first wave, everyone should consider themselves to be an asymptomatic carrier. Berkat bat Kenya ladi bapila banlong unong ra ubla don kabriu ni ubriu o pila bandon bupai to khnyang jingpang henrei kimpa kidakishin kumno phina banya dai la di ba ki wei deng ki mas thet ila ki jong ki kti penjngai iwei na iwei pat, and do not drop your guard.